Good.
Hello, how are you today?
I'm good. How are you?
I'm doing well. My name is Rachel, and I'm the nurse educator here at the clinic. Can you tell me your name, please?
Sure. It's Elizabeth Cordero.
All right, what's your date of birth?
August 14th, 2002.
All right. So, what can I help you with today?
So I was talking to my friends and they were saying something about a different kind of birth control. Like I take the pill, but I can't remember to take it every single day. And they were saying that there's like a shot or something that like a Depo something that I could take and it's not every day.
Oh, okay. You must be talking about the Depo Provera shot.
Yeah, something like that. That's
Okay.
it.
All right. All right, well, let me go out and get some information about it, being you're interested in that type of birth control, and we can go over it.
Sounds good.
All right, I'll be right back.
Okay.
All right. Got a couple of brochures, so you can look over it while we're talking about it.
Oh, nice. Thanks.
And just ask me any questions along the way if you have any. We'll go over a couple of the some of the information about it. All right.
Okay.
Okay. So let's start off with the basics. The name of the shot, like we talked about earlier, is the Depo Provera.
Okay.
As we mentioned above, it's an injection. It contains a synthetic form of the hormone that our bodies already produce, which is progestin.
Okay.
The synthetic form is called the Depo medroxyprogesterone.
Oh, that's a big word.
Yes, hard to say. Sorry.
That's okay.
And then it has the word acetate at the end of it. Anyway, so that's the synthetic form of it, and that's what the injection is going to contain. And it's a hormonal method of contraception, so it's similar to your birth control in that way. Only the birth control pill contains two hormones. This one just has the one.
That sounds right. I think mine has two at home. I'm pretty sure that's what I have already.
Okay.
But is this the only way that I can take it? Because you said something about a shot, and that sounds painful.
Right. Well, to be honest, like any type of injection, you're going to have a little mild discomfort.
Okay.
So it will be injected into your deltoid muscle, which is your upper arm.
Okay.
Or it will be injected into your gluteal muscle, which of course is the buttocks.
Lovely.
And you'll get this injection one time every 3 months. So it's either 3 months, 13 weeks, somewhere in between there.
Okay, so I don't have to take it every single day, but there is the whole reminding me factor because there's even bigger chance of me forgetting, like every 3 months. Are you guys going to kind of let me know, or?
Okay, good question. And of course, being that you come into our office, so it's like an office visit, so we'll set you up on like a text message alert,
Lovely.
voicemail, whatever you get normally at your doctor's office for reminders.
Okay. What can I expect as far as like side effects? Is there any reason why I shouldn't be taking this?
Okay, so let's see. Side effects, a lot of them are similar to what you're used to already on your current birth control pill.
Okay.
The most common one is irregular periods. There might be some light spotting between your periods. Some women may have lighter periods, some women may have heavier periods, so it just kind of depends on your body.
Okay.
Other side effects, you can have dizziness, some headaches, nausea, breast tenderness, fatigue, being tired, changes of appetite. And yes, that does include moderate weight gain.
Okay.
Rarely or occasionally you may get some acne, backaches, bloating, depression, leg cramps, hair loss, or excessive hair growth. So those are the less common, but still needs to be included.
Wow, that seems like a lot. I think I already experienced some of that stuff, so I'm not too concerned about it.
Okay, great. Let's go over some of the advantages. Being we talked about all the bad stuff,
Okay.
let's talk about a few of the good things. So if you take your shot on the first day of your period or the last day of your period. So anytime in between there, when you go into the office and take your shot, the protection against pregnancy begins immediately.
Oh, nice.
So it's very highly effective. There's less than 1% failure rate if used correctly and consistently. So we're not talking about missing doses, waiting a week. Oh, I can stretch it to 14 weeks. No, it has to be, your specific time. Of course, like we talked about earlier, you may have some lighter periods.
Okay.
So that is another advantage. And you may even have no period at all after a year.
Okay.
And also, another good thing about it is because it does not contain the estrogen, like the most of the pill does.
Right.
It won't increase the risk of heart problems.
Oh.
So if you have any blood pressure problems like in you currently or your family, it doesn't increase the risk for that.
Okay, well, that all sounds great, but is there negatives to this? I mean, is there anything that I need to be worried about?
Well, we did talk about some of the side effects, but let me ask you a few questions.
Okay.
That way we can kind of go over if it's safe for you to take this medication.
Okay.
So let me pull them up on my computer here.
Sure.
Okay. Are you pregnant?
No.
Or do you think you might be?
No.
Okay. All right. Do you have any unexplained bleeding from the vagina that you wouldn't consider your normal period, like anything other than that? Okay. Do you have any breast cancer? Have you ever had breast cancer?
No.
Okay. Have you ever had a stroke?
No. I'm 17. No.
Okay. Have you ever had any blood clots in your arms, legs, or lungs?
No.
All right. Do you have any issues with your liver, or have you ever been diagnosed with any liver issues?
Nope.
All right. Do you have any of the following? Depression, diabetes, high blood pressure, or heart disease?
Nope to them all. Does that mean I'm in the clear?
Well, it looks like you could be, but I do want to go over one more thing.
Okay.
And it's very important to discuss because you are a teenager. Still a teenager, not quite there yet.
Oh, shucks. I'm lost.
Your body is still developing bone strength.
Okay.
So this medication can decrease the calcium in your bones because it is not recommended that you take it continuously for 2 years. So anything more than 2 years, then you need to switch over to a different birth control method.
Okay.
You can go back to the pill, whatever that you decide to do after that time. Although while you're taking the pill, because of the increase in decrease of calcium in your bones, proper exercise, daily exercise, weight-bearing exercises are always good to help build up that bone. Also supplement with calcium, vitamin D. You can get that in a multivitamin, like a daily pill. If you already take one, that's great.
Okay, that seems like something I can plan for later in the future. That doesn't seem too difficult.
Right. We'll talk about that later on when the 2-year time period comes along.
So realistically, what's this going to cost me? Like, I'm a teenager.
Right.
It's expensive.
Understandably. So being that you come into the office, you could be charged an office visit.
Okay.
You also will be charged for the shot, the injection, medication. It usually runs around $35 to $70, just depending. Not upstairs in billing, so I'm not really sure what our particular office charges. But usually insurance companies cover the full cost. They're all about birth control, preventive, so.
Okay, it's good information. I'm glad I at least know that. I think I'm supposed to get my period sometime next week, so could I make an appointment today for next week so I can get this done?
Oh, sure, as long as you don't have any other questions.
No, that was it.
Okay, well let's go up front and we'll make you an appointment.
Great, thanks.
You're welcome.